Welcome, everyone, to another episode of the Health Made Simple Show. I'm your host, Dr. Bart, and today we're going to do a deep dive into a conversation that I'll tell you, it's probably not the most sexy topic, although I will tell you it may be one of the most important ones that we have a good understanding of. And so today I'm going to do a little bit of a deep dive on the conversation about, or the understanding really about, what is and what expectations should we have from our healthcare system versus personalized healthcare. And there is a massive difference between the two. And that is why I want to do a little bit of a deep dive here. I think what's driving most of this is that on a daily basis, what seems to be a daily basis now, is that I continue to have conversations, more and more conversations with people that have been in the healthcare system, which I'm going to define for you in just a moment. And inevitably, there's massive disappointment, tons of frustration, often heartbreak, and oftentimes very, very poor results that are taking place as a result of it. And I want to help clear that up, because if we understand there is a massive difference between the healthcare system that we currently have and then also what we call personalized healthcare. And if you don't understand these two differences, you might think they're all one, and they are not. And that is why I'm bringing this here today to you. So make sure that, again, I know I always say to do your best to, continue to share it out, spread the love here. I would share this out as much as can be. Politically, you always hear healthcare system, folks, it's broken. Well, but if I was to back that up, I would say that it's not broken. It does exactly what it's designed to do. And that's what's scary. So let me break this down for you today. Keep doing the thing, keep sharing out, keep spreading the love. I'll get through this as quick as I possibly can, just to kind of keep things in the same realm of, the healthcare, making health simple for you. I'm going to try to simplify this topic for you and also give you some real life experiences and understandings of it. So with that being said, keep doing the thing, keep sharing out, keep spreading the love, and let's dive right in. So today we're going to kind of call this the healthcare system versus personalized healthcare. And I'll start by saying, it's not because there's good guys and bad guys, or good women and bad women in either system. Rather, they are two different, very distinct, different systems. Although we think they're both the main objective is health for us, the patient, it's not always that. So again, I'm not trying to call out a good guy, bad guy here, but I'm really just trying to position what we're looking at when we enter either one of these by choice. And that's what we have to understand. That's my goal here today, that by the time you get to the end of this, when you make your future decisions, that you're going to make some decisions, hopefully understanding which decision you're making. Am I entering a healthcare system, or am I entering personalized healthcare? And there is a massive, massive difference. And all right, so let's just dive right in. Let's first just to start by, I'm going to break this down into really four categories. What is the healthcare system? What is personalized healthcare? What are the real life implications here? Then we'll conclude it all. All right, with that being said, let's dive in. What is the healthcare system? This is the system that we are most familiar with. This is the one that you get unwell, you get sick, you get a cold, something like that, you run off to the hospital, your primary care provider, and now you are in what we call the healthcare system. And within that system, here are some of the key points that I want you to understand. That your health, this is going to sound so bad. And listen, I know a lot of you are healthcare providers listening to this. And if you have comments, if you want to agree with me or disagree with me, put them in the comments below. I'm comfortable with that, because this is the conversation we have to have. In the healthcare system, the goal is that the system works properly. It is not about the patient. Listen, patients are important, no doubt, because they feed the system. And in healthcare, the system, going to the hospital, you using your insurance card, going to your primary care provider, that is all part of the system. They have very specific desires here. And the desire is that they are using their policies and profits as their primary purpose of being in existence. The patient is the tool by which they are able to utilize their policies and increase their profits. I know that sounds kind of cold and harsh, but understand that it's the sad truth. And that is why often we see so much frustration and so many challenges, so many heartbreaks when people enter the system. I've talked a lot about it here on the healthcare, the Health Made Simple show, that often when people enter the healthcare system, the first thing they realize is that there's not a quarterback involved, meaning that there's not a person, a man, a woman, a team that is focused on their personal needs to help them through whatever journey they're going through. And as we get a little bit later in life, those journeys oftentimes become a little more challenging. We start to see things like cardiovascular disease. We see metabolic disease like type 2 diabetes. We maybe see cancer. We see these diagnoses that are a little bit more involved, a lot more complex. And unfortunately, if you've entered the system and you get diagnosed with one of those, you really quickly understand there's not a quarterback. There's a whole bunch of different people following policies and procedures. One of the key things that differentiates this between the healthcare system and personalized healthcare is that unfortunately it is driven by, not by the patient outcome, but really by big pharma and the insurance companies. And again, I know this is going to rub some people wrong, and it's okay. I'm not even making this out to be bad or good. I'm just telling you there's two different systems, and we have to make the decision, which one do you want to be in, and stop pretending that they're both the same thing, because they're really not. So generally, the healthcare system is a system that prioritizes policy and profit. And here's where it gets really tricky. If you work for that system, the amazing men, women, the doctors, the nurses, the coaches, whatever they may be that work within that system, they're handcuffed. So again, they are not bad or good. Some of those are the most amazing men and women that got into this for the very good, very right reasons. But their paycheck comes from the system, does not come often from the patient. And as a result of it, if they deviate from their policies, and this is where the rubber hits the road, folks. Rubber hits the road. If they deviate from those policies, they can actually get in big trouble. They can lose their jobs. They can get sued. We saw this. We saw the evidence. We saw back around that COVID time that if doctors were recommending outside of the box, out of the normal standardized operating procedures, the standard of care procedures based on policy, if you went outside of the box, like maybe you recommended ivermectin, knowing that it had no harm, but it might do good, but it wasn't part of the standard operating procedures, wasn't part of the standard of care, you could lose your job. And so doctors, men and women across the country that were looking to give the best care they could for their patients inside the system, the healthcare system, they were not allowed to. And that is the same reason today we see many doctors within that system knowing, especially with the advances, that we now know how many different, let's say, vitamins and herbs and different lab tests that we can run to super expedite the health of people. But they can't do it because it's outside of the box. It's not within the standard operating procedures. It's not within the policy. It's not within the profit margins of that system, the healthcare system. And folks, that for a reason. Now, some will say the system is broke. And I will tell you this, I don't think so. I think it does exactly what it's supposed to do. It's focused on symptoms. I know these words are going to get tossed around a little bit. System and symptoms. Symptoms mean that you have high blood pressure, stomp it until it gets low. Load it up on a medication. You have high cholesterol, stomp it until it gets low. Suppress it. Bombs away with the medication. Symptom care is way different than healthcare. And so if you're listening to this, you probably already understand that. But that's why I say the system is not broken. It is actually a very good system. It works very efficiently within its parameters. Us having the understanding, you having a better understanding and really defining and understanding what you're choosing. Is it personalized healthcare, or are you choosing this healthcare system? Because once you get in it, then it can give you a certain set of expectations. Going into the healthcare system and expecting your provider to do any and everything possible or suggest or recommend all of the best options for you, that's unfortunately on you. That now, especially now knowing this, because that's not going to happen. They're going to be held they're restricted within their own box to provide you only the suggestions and recommendations that fulfill the requirements and the needs of the policies and the profits of that system. So with that being said, now let's shift and take a focus, we'll call this step 2. Let's take a look at what it means to be part of a personalized healthcare system. This is entirely different. Here is the focus is the patient. I know that sounds odd, but the focus is the patient. And the focus also, the derivative is typically going to be the root cause. What is the thing that they are looking for? So you come in, let me see, you come in with high blood pressure. And yes, in the healthcare system, you stomp on it to make it go low. In personalized healthcare, you're looking for the root cause. What is the cause of this high blood pressure? And then what can we do? More specifically, what can you do to help yourself rid yourself of this high blood pressure? Both agreeing, both mechanisms here are agreeing that high blood pressure probably isn't great over the long haul. Here's the big difference, folks, and this is why I still think that we need both care, both types of opportunities for people. The reality is, and probably not most of you listening to this, but the reality is in personalized healthcare, you're going to have to take responsibility. You're going to be accountable for your own health. You're going to be responsible for your accountability. You're going to be accountable for your diet, for your exercise, for the actions that you take. Essentially, your actions collectively are going to give you your outcomes. And therefore, you become very personally integrated in your own health care. In the healthcare system, this is not true. This is not how it works. You are not held responsible for your exercise. You are not held responsible for your diet, your overall well-being, your train of thought, how much you sleep, none of the above. It is only based on your symptoms. And for example, we know this, especially I've been practicing nearly 30 years. If you go in, you get a little bit of a diagnosis of, let's say, elevated blood pressure. This is typically how that conversation goes. Well, Mr. Jones, you're 55 years old. Looks like you have a family history. Your dad and your grandpa both had heart disease and they had some high blood pressure. And now you got it too. You've come of age and looks like your dad and your grandpa and your cousin and your neighbor and your dog and all those ones, they all had high blood pressure and therefore so do you. Here, take this medication. Let's stomp it out. And Mr. Jones has a couple options at that point. And let's just say you are Mr. Jones. So you have a couple options. You can say, phew, just an easy way out. My dad, he didn't give me good genetics and poor me, kind of the victimhood. And then you take your medication and go on your merry way. Or you look for personalized healthcare. And here's where it gets tricky, because in personalized healthcare, they may say, hey, you, Mr. Jones, how's your exercise coming along? When's the last time you exercised? Are you walking after dinner? What kind of food you putting in your body? Are you taking care of your sleep? Are you taking care of yourself? Are do you have any, time out? Do you have any meditation or prayer in your life? And these all become these accountability moments. And that's why I say it's not for everybody. Not everybody. I know it sounds insane that everybody wouldn't want to take personal responsibility for their health. And there's no judgment, folks. I've been doing this long enough to just tell you, not everybody wants to take personal responsibility. Do I think that is because of long-term, very specific, intentional hypnosis? I do. And that might just make me crazy, but I do believe that is the idea. We see commercials from the time we're sitting in front of a TV to this point in our lives that says, if you have pain, take this, make it go away. If you have a stuffy nose, take this, make it go away. Acting as if our symptoms aren't actually the way that our body talks to us. So I don't derail too far on that. I do believe there's a place and a need for both. And this is not even accounting for what we call the emergency care system. That's an entirely different. This right now, I'm just talking about healthcare system and personalized healthcare. All right. So now and again, just in the personalized healthcare part, this is the big constraints of when you're in the healthcare system is big pharma insurance are going to dictate what type of care you get. In personalized healthcare, it's entirely different. What's going to dictate what type of care you get is how open you are to doing it. Some of it is going to come down to resources, but the beauty is when strategically placed lifestyle changes are made, that's when the most changes are going to happen in your health, hands down every single time. Genetics play a role, absolutely, but genetics is what loads the gun. It is your lifestyle that ultimately is going to pull the trigger. The beautiful part of that is meaning that things like exercise and sleep and the way that you think and your diet, huge, massive players when it comes to your overall health. And if you get those dialed in appropriately for you, especially with whatever you have going on personally, and your provider helps you quarterback all of those things, you've got great opportunities, great chances of becoming a healthier human being, and then therefore ridding yourself of a bunch of different symptoms that you experience. So the root cause emphasis is where personalized healthcare differentiates itself much more. Now, let's bring this into some of the real world implications of what does this really look like for you and I as we're out there seeking providers and we're seeking to do the very best we can with our health, knowing that the truth is things like age are a huge player. And so I don't know if it's because I've been practicing for 30 years now and my experience, or the fact that I've just, who knows. But I will tell you this, more and more, whether I'm inviting it or choosing it or not, more and more I have people coming to me with all kinds of very, very complicated challenges, cancers, all kinds of diseases, folks. And I see it more now than I ever have at a more rapid pace, rampant and rapid, and all age groups. So it's not just the elderly. Not when I say elderly, 50, 60, 70, 80 plus years old. I see it in younger people as well. I do think that it's partially caused because of some of the things we put into our bodies. A lot of people, about I guess 75% of our country put a particular jab into their body a couple of years back. And do I think that has ramped up the speed of disease and disharmony in the body? I absolutely do. Call me crazy, call me a wacko for saying such a thing, but I am allowed to observe. I'm allowed to sit back and observe what's taking place. And I think that we have ramped up as a result of that and so many other things, the toxins and the chemicals that we are being exposed to on a daily basis. These are all contributors. And what that means to you and I is this, is that we're going to need to be able to do deeper dives, to look outside of the box, to potentially incorporate all of these things that seem a little bit weird. Who knows? Maybe it's the use of ivermectin. Maybe it's peptides. Maybe it's herbs and vitamins and concoctions and very specific personalized herbal tonics for ourselves. Maybe it's red light therapy. Maybe it's cold plunge. Maybe it's sauna. Maybe it's meditation. Maybe it's energy work. Maybe it's learning how to breathe again. Maybe it's learning how to regulate your nervous system. Or maybe it's all of it. And maybe we need to do a little bit of work in there. And many of you listen to this, probably 75, 80% of what I just mentioned there, you're dabbling with already. And having someone to help coordinate all of those different things, that is what personalized healthcare is all about. So here's what this means, the implications in the real world. So in the healthcare system, unfortunately, it may let you down because you'll get into it thinking that somebody or something is going to coordinate all of this for you. And you would believe that because your entire life, this is what you've always thought. If anything goes wrong, I'm going to jump in the healthcare system and it's going to help me get better. And that's not necessarily true, folks. If you've been in it, or you have a parent or a family member who has had to rely on the healthcare system to get them well, unfortunately, there's a good chance that you have a lot of frustrations and a lot of animosity built up against the system because you realize it is not what it's hyped up to be. And again, it's not a good guy, or good girl, bad girl situation. It is just understanding what the healthcare system is. Its boss is big pharma, the policies and profits. So the insurance company's in there, and then you have now what is dictating types of care. And again, on the flip side, personalized care is going to be a little bit different. Here's unfortunately a way, not unfortunately, here's a real way. And again, I'll probably catch a little flack for this, but I'm going to do it anyways. When we look at the healthcare system, it usually also means involving your insurance. If you want to know whether or not you are going to be treated as if you are the prime goal here, your health is number one, most likely you're going to have to seek out cash paying practices. You say, well, wait a minute. Oh, why would I do that? I have insurance. Here's why, folks. If you use your insurance card, the insurance companies have contracts with your doctors. I used to be an insurance provider, not a provider, but I used to accept certain types of insurances. What they don't tell you is that as a provider, when you decide that you're going to be in contract, that's what it is, a contract with your healthcare carrier, with the insurance carriers, Blue Cross Blue Shield, Aetna, one of those big guys, right? United, that you then you're in contract with them and how you will and will not take care of your patient. And that's what a lot of times consumers don't understand that. So those providers that are utilizing insurance in their practices, unfortunately, they are handcuffed by what those insurance carriers tell them they can and cannot do. And that's why across our country, we saw, especially a couple of years ago, back in 2020, 21, a lot of providers were not allowed to make suggestions outside of the convenient box and policies and profit margins of what the insurance carriers and big pharma told them to do. So in the event that you want to find the absolute best option for you, your health, your family to level up, most likely you're going to have to find a cash payer. And I'm a cash pay provider. Let me explain how this really works. If you're a provider and you work within a healthcare system where you accept insurance, this could be across the board. This could be your local chiropractor's office, or this could be in a hospital. But if you are still accepting insurance, you're answering first and foremost to the insurance company. That's the reality, folks. Secondary to that is your patient. So basically, you are paid by the third party, which is your insurance company. So that's who dictates your job, is your insurance company and the system within it. So they need to be a profitable system. So that is the difference between a cash pay provider is when you are in cash pay, you have to work directly for your patient. And here's where it really gets interesting. And this just makes the common sense. You're probably scratching your head and saying, well, you will in just a moment, and say, well, this makes perfect sense. Isn't this how it should be? So cash pay providers, the ones that say, hey, listen, I'm going to treat you. We're going to exchange. I have a certain fee, and I'm going to provide you a service, and you're going to pay me for this service, fee for service. In that situation, your income is dictated by your outcomes. If you are very good at what you do and you get great outcomes, most likely you have a very good income. And that seems fair. That makes common sense for everyone. If you are really good at making pizzas and everybody loves your pizzas, people are going to come back for your pizzas, and they're going to tell their friends about the pizzas that you deliver and that you cook up with specialty, with personalized love and care for that particular pizza, consistency, and people will continue to get those, and they refer all their friends. And that's what you get from a cash pay provider. So I'm not telling you that you can't use your insurance, but I think it's very important that you understand when you are using your insurance, it's most likely not going to be personalized healthcare. I'll just give you another simple example. If you have high blood pressure, again, their job is to stomp it low. It is now on your record. You have high blood pressure. What is the standard operating procedure? What is the standard protocol for someone with high blood pressure? You give them medication. If you're outside of that, someone who doesn't work for the insurance companies, not working for big pharma, they can then say, man, there's a couple other options here. So for example, someone like myself, we look at those things. I'll give you an example of what root cause. One person comes in, you come in with high blood pressure. You're in a normal healthcare system. If it's high, they smash it low. You come into, say, a functional medicine doctor, someone who's working for root cause. That is what we're looking at. We're not looking at just treating that symptom. We're looking at the body. We're saying, well, what could be causing this high blood pressure? And it could be so many things. So it's very common in a functional medicine practice, we would then say, make an assessment of or analysis of, let's just make sure you're sleeping enough, because if you're not sleeping, there's a tendency for your blood pressure to go up. Let's just make an observation of what's taking place with the overall stress. Is there something we can do to help you manage your stress? Let's take a look at the different vitamin deficiencies you may have. Is it possible that you have something as simple as magnesium deficiency? 60% of the country does. So yes, what if we started to get you on some magnesium and made some observations? And maybe that was helpful, but it didn't do the whole trick. What if we used a little bit of something like a vitamin B2, which is a vasodilator, which helps open up the arteries and it lowers the blood pressure naturally just by supporting a nutrient deficiency. And are most people depleted in their vitamin B? Absolutely. The body uses it for all forms of stress, etc. So we take a little bit of a different approach here to make sure we get the absolute best desired outcomes that are sustainable, and we make sure that we do it in a healthy way, looking at your root causes versus just your symptoms. And those are some of the implications. When you start looking in the big picture, the implications in real life is that you become the target, not the policy. The target is probably a bad word here, but you become the primary focus of your provider. And so like someone like myself, nowadays, we're seeing so many different things. Do we make suggestions when it comes to all of this? Do I, as a provider, do I make recommendations for someone to take ivermectin? I don't. That's not my license, doesn't hold that. Yet will I make suggestions that we do a deeper dive and maybe find providers? Yes. That could get them ivermectin? Yes. Same thing with different peptides. We provide some of those. Certainly we can help facilitate that process. Vitamins, herbs, lifestyle recommendations, a chiropractic adjustment for their nervous system, all of these different things. And if they are presented for you, then you have your options to continue to make yourself a better, stronger, healthier human being, versus the healthcare system is just going to be stomping on your symptoms and potentially leading you to more. We do know that typically, once you go on one medication, it is a kind of a snowball effect, this downhill snowball effect of where you then start to going on more and more. And those of you who have been in, you or your family member has been in the healthcare system for a while, especially as we age, you become more and more frustrated with it. And that's reality, folks. And it's because, especially as we age, we see that when I talk about age, let's say 70 plus, you see that it just becomes appointment after appointment, visit after visit, poking and prodding and testing and all of these things on an aging body. And instead of supporting the natural components of aging, they just keep smushing the high blood pressures, the cholesterols, and keep smashing all these things down, but never really focusing on that individual, where they are in that point in their life, and the needs and the desire. Well, it may be desires for them just to become more comfortable with that phase of life. So if you're listening to this, you've gone this far, my guess is that this has become more and more relevant in your life for you to understand that there's a massive difference, folks, between the healthcare system and personalized healthcare. And as we move forward with the advent of AI, for you to seek out your team, and that's really what it is. So I'll conclude with this kind of thought here. As the future goes, for you to start to look at your healthcare approach as who's going to be on my team? Who are you going to allow on your team? And are they going to play like a teammate, helping me with all their skill sets and all their tools? Are they going to show up to play at 100% all the time? The beauty of the cash paying provider, two things can happen, which I think is fantastic. At any given time, if the healthcare provider, and you're paying cash for them, are not meeting your needs or your expectations, now, granted, they don't force results upon you, but if they're not meeting your expectations in their efforts, their openness, in their communication, they're seeing you as a individual, personalized human being, you can fire them. But when you're in a healthcare system, you don't get to really fire your insurance company. In fact, you're kind of trapped. And the other side of this, which is really nice, is that if you are a patient and you are not a real good participant, and you don't take accountability for your own health, and you do not participate in helping the doctors get to the root cause, sharing important information about how you sleep and how you eat and all of the other things, and be accountable for your actions, the doctor can fire you, which is, I'll tell you, like, it doesn't happen to me a ton at this point, but every now and then, not everybody is a great fit, because not everyone wants that accountability. And if my job is to help as many people as I possibly can get incredible outcomes, then I have to make sure that those people that are in my system, that are participating in my kind of way of doing things, want to be in there, that they want to be accountable. They want to be held accountable for their actions that they are or are not taking. So with that being said, real world applications here. Pay attention to the team that you are building around you and your family's health. There is a place for both the healthcare system and personalized healthcare. Understanding the difference, the massive, massive difference between the two could probably save you a lot of heartache and a lot of frustrations, a lot of angry moments here. So with that being said, if you do want to participate and say, listen, that's what we provide. We provide personalized healthcare. If you want to participate with me or someone on my team, we'll make sure there's a link below. You can do that. And it doesn't matter where you live. We can send you labs. We can send you requisites, or we can do consults over the phone. So just know that there are opportunities for you everywhere. It doesn't have to necessarily be in your hometown. So with that being said, use this information to continue to do your thing. Keep leveling up and making sure that you're taking deliberate action for your mind, your body, overall wellness. You all be awesome, and make sure that you continue to participate and check in with us on the next Health Made Simple show. Take care now.